Hi, I'm Cal Beyer, Vice President for Workforce Risk and Worker Wellbeing at CSDZ, a Holmes Murphy company. I'm a longtime CFMA member and volunteer leader. I'm also known as a national advocate for mental health and suicide prevention in the workplace. I've volunteered with the National Action Alliance for Suicide Prevention since its inception in 2010 and on its executive committee since 2016. I also serve with the Expert Advisory Group for the Center for Workplace Mental Health and on the Lived Experience Advisory Committee for the Suicide Prevention Resource Center. EAPs are frequently underutilized. One reason is the stigma associated with accessing services. Companies that are leveraging EAPs successfully and achieving measurable results are engaged in the selection of EAPs and the services. Those leaders are talking about the EAP and the services that they've accessed and how it's helped them and their family members. That's a powerful way to show vulnerability and to let people know it's okay to not be okay. Secondly, companies recognize that EAPs are not created equally. A strategy is to invest in a top tier full service EAP as opposed to an embedded or so called free EAP. In this case, you do get what you pay for. Request impact metrics from your EAP. How are they going to help you achieve measurable impacts in reducing absenteeism and presenteeism, perhaps by reducing emergency room visits? What's powerful is EAPs purchased directly by employees have been shown to have 3 times the number of counseling cases and 6 times the number of work-life cases, and up to 9 times more organizational consultations than those from an embedded EAP. Other strategies will include having managers, supervisors load EAP information into their cell phone so they can forward contact cards to employees rather than saying, I'll get back to you. Another strategy is analyzing utilization data and developing promotional and educational and communication strategies. Holding timely kickoff meetings with EAP providers immediately upon service inception is another strategy these companies use. And another is how they will drive leverage service from that EAP. They'll talk about the managerial training that's available. They'll make that available to supervisors, and they will increase utilization by teaching employees about the services available. And another strategy is including EAP information in new hire orientation and onboarding processes. Those are some of the strategies that companies are using. Let's face it, talking about suicide can be a tough topic. It's not a natural conversation for most of us. Many of us will find it difficult to even initiate a conversation. It's easier to talk about suicide when it's conversational. So practice these conversational tips with family members and friends before you try them on coworkers and colleagues. A way to open the door to a conversation is to have a one-on-one contact. Seek out private places where you're not going to be interrupted or distracted. If you're on a job site or in the workplace, ask if that person can take a break and then take a walk. That's a great strategy to break the ice. Or better yet, invite that person for lunch or coffee. A couple of tips I'd like to share. Make eye contact. Ask the person how they're doing. A favorite opening for me is, are you okay? Listening for a response is key. Being attentive, making certain that you're listening, and making eye contact so they sense your empathy and your concern and your willingness to help if they need that. A couple of things to do are to share some observations. You're not going to be a diagnostician or a clinician. You're just going to be someone who cares. So ask how they're doing. And if they say, I'm fine, you could say, it just seems like you haven't been yourself lately. Is everything really okay? It doesn't seem like things are fine. I'm here for you, and I care is another strategy. Continue to listen intently, Mostly, resist the urge to fix things. That's a really important part of this. Ask if they have access to an employee assistance program and share contact information for the National Suicide Prevention Lifeline or Crisis Text Line. Be assured, talking about suicide isn't going to put that idea in their head, but it might let them know that there's reason to be hopeful. They're not alone. They have a person who cares about them and who's demonstrated a willingness to help. You could be an answered prayer for that particular person. If they express concern about suicide or self-harm, stay with them. Encourage them to call one of those lifelines and make the call together with them, continuing to stay with that person. This is a basic strategy for initiating a conversation about suicide.